Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. This show is sponsored by Mark Drugs, who specialise in the custom compounding of medications, assuring that the client gets the proper prescriptions for their unique needs and conditions. They work with practitioners, integrating knowledge and treatment of experts to create comprehensive health plans. Visit markdrugs.com or call Roselle 630 529 3400 or Deerfield 847 419 9898. My guest today is KC Devine, who is a family nurse practitioner practicing in Albuquerque, New Mexico. KC takes an integrative approach to health conditions and focuses on root causes instead of chasing symptoms. She particularly likes treating hormones, including thyroid, adrenal and autoimmune disorders. She joined Well Life Family Medicine in 2015. Thank you for joining us today, KC, and welcome to the show.
Thank you for having me.
Can you tell our listeners what made you decide to become a nurse practitioner? Was nursing something you wanted to do as a child?
Yes, I remember pretty distinctly at about the age of 6, I had hepatitis A, and being exposed to doctors and blood draws and stuff. I was absolutely fascinated with everything, and I knew then that I wanted to be medical. And coming out of high school, the nursing route seemed like the best way to be in medicine, that still offered a lot of opportunities in the future.
And what training have you had so far since you were qualified?
I went straight into college out of high school and got my bachelor's in nursing and became a registered nurse. Then I joined the Army and got some additional training there, and practiced as an RN for about 20 years, a little over 20 years, and decided it was time to expand my scope, and went into nurse practitioner school that takes about 3 years. Mm-hmm. And so you get your master's and then a postgraduate certificate as a family nurse practitioner.
So LDN, when did you first hear about it?
I first heard about it when I started working at Well Life Family Medicine. I work with a doctor of osteopathy, and first came across it then, and it's a very fascinating medicine with lots of applications, and so used it here and there, and the more I used it, the more I liked it. And so I instead of being kind of a second or third line treatment, it's starting to become my first line for a lot of things. And
having been in the military, many doctors are prescribing it for post-traumatic stress syndrome now, so that seems to be working really, really well. And as I have learnt, it's not only veterans that suffer from that. There is also rape victims and people that have had traumatic events in their life. So it's nice to know that LDN is helping not just people with pain and autoimmune conditions, but with mental health as well.
And yes, I've only become aware of the mental health applications, and that's pretty exciting. And you know, I was always really proud of military medicine in this country, that they always seem to be rather cutting edge, and I don't think people realize that military medicine can actually be ahead of other types of medicine there. And so I'm not surprised that they're using it on PTSD and kind of being the forerunners there.
I have to say, my daughter is a nurse, and she's going to become a nurse practitioner. But when she was
Great.
in medical school, they had one of the lecturers there, and he used to do stints, whether he was territorial army or whatever. He used to go to war zones anyway, helping out, treating the soldiers. And my daughter was like, oh, that's what I would really like to do. I'd really like to do that. And I was thinking, oh no, really? But she'd got a 3-year-old, so she didn't go. But I can imagine it's you must yourself must see some horrible sights being a military nurse.
Yeah, I got out quite a while ago, so that's kind of a past memory for me. And I pretty much, I was never in a war zone, so grateful for that. But,
well, yeah. I think the nurses who do go to the war zones really are heroes, aren't they?
Absolutely, yes.
It cannot be easy, no.
No.
And so what conditions have you treated with LDN?
I started treating the autoimmune thyroid with LDN. That was kind of where I dipped my toe into the LDN water, and had some good results. And people, I think the thing I noticed the most was not so much the numbers of their antibodies going down and all that, but that they just felt better. And these were people that usually were at our clinic kind of after having been through a lot of different providers, and they still felt really bad, and they were kind of grasping, and they started LDN, and they just started feeling better, and they couldn't even really put their finger on it. And I still have that. I still have a hard time with that when patients ask me, well, how do I know it's working? And it is kind of hard to give them something to like put their finger on. It's like, well, you're just gonna feel better. It's hard to explain. Yeah. And then after that, really started expanding into anything that was autoimmune, and kind of finally grasped the concept that if it's autoimmune, LDN was certainly something to consider, no matter what the autoimmune was. So rheumatoid arthritis was the next likely kind of candidate. And, what a fantastic option to have when the only other options are the very severe immunosuppressant medications that nobody wants to be on. And so what a great thing to replace that with potentially. And then now I'm starting to expand into chronic fatigue and depression, and even just anything that I'm thinking about boosting the immune system. So concurrent cancer support, or post-cancer support, cancer treatment support, and even things like herpes, trying to boost the immune system for that.
The practice that you work in, being family, does that mean that you treat babies up until, geriatric patients and everything in between?
Yeah, we like to say womb to tomb.
Yes.
But yes, the full spectrum of ages, which is
because a lot of children take LDN as well, not just for things like pediatric Crohn's, autism, juvenile arthritis, but allergies and eczema and environmental issues. Have you experienced prescribing LDN for children?
No, I haven't. That's quite fascinating. Are the doses the same?
Well, you'll have to listen to the LDN conference. We have two doctors talking about, 3 doctors talking about LDN in children. And how they go about finding out the dose and working the dose up. But it would seem that the dosing is more or less the same, but they start off lower, and by titrating it slowly, you can find out what they tolerate best. I think that is the best way of putting it, because LDN really isn't a drug like paracetamol take 2-4 times a day. Everybody is different.
Mm-mm.
And I don't know what your experience has been, but my experience of talking to so many patients, some do really well on 2 milligrams, but they have been told by their prescriber that the optimum dose is 4.5, and they keep trying to push past 2. And every time they go higher, they don't feel as well, and I'll say to them, well, if 2 worked really well for you and you felt so good, why don't you stay on 2? Oh, because I'm going to feel so much better on 4.5. But every time you increase it, you don't feel as well. So, 2 probably is your optimum dose. But it's the way people's mindset is when they think, I'm going to feel that much better. But they just can't get there.
More is better.
Yeah, exactly. But it's what suits you best. And I think it's the same with children. Do you have any autistic children?
No, I don't. Not at this point.
Well, thank goodness for that. It's every parent's worry, I think. Yeah. So it's amazing that you're using LDN as a first-line treatment rather than introducing it later. There are still a few doctors that...
Starting to.
Mm-hmm. Starting to, yeah. Who possibly wait a little while doing lots of testing and so on. And I should think that is what you're doing with your patients, with all your hormone treatment. And thinking about hormone conditions, thyroid conditions rather, do you find that people's thyroid levels drop and you have to monitor them carefully when they're on LDM?
Oh, definitely. And they get the warning that that they may notice that they're being over replaced with their thyroid medication when they start this. So they definitely get that warning. And I give them a plan on how to drop down a step or to drop down a half step. And then, of course, they can always call me. But
yes,
they definitely walk out with a plan of how to handle that. Because that's a likely. That's not just a maybe.
Yes.
Scenario. That's a likely.
And
very exciting.
Yeah. So, what are your thoughts of LDN in the use of conditions that there's a pain element? Have you found that the pain is more under control?
Yes, I haven't used it like for complex regional pain or anything like that, but I've used it for rheumatoid arthritis, and there's a noticeable improvement. And so, in a way, actually, rheumatoid arthritis is a nice one to treat because there is a symptom that I can say, you are going to feel better. This is going to hurt less, and that's how we know it's working. So some of these, it's a little more vague, but rheumatoid arthritis, actually, they can kind of put their finger on that one a little more specifically.
And what about fibromyalgia? Have you treated that?
Yes, I like it on that one too, because there's, the depression component of fibromyalgia too. And so it kind of has two birds with one stone.
And a lot of people with fibromyalgia find sleeping difficult. And it would seem as though for the first time in years, many of these patients, after taking LDN, actually sleep so much better. Yes, and then, of course, sleep helps with pain. So exactly, all the pieces start to fall into place there. I mean, if you sleep properly and a deep sleep, it helps everything, doesn't it? Because if you're tired, everything is magnified. Yeah, if you're not sleeping, you're not healing. No, you have to sleep. That's the number one priority for pretty much anyone in this clinic. Is if we can't get you sleeping, we're not going to get you better. Oh, that's good. And has anybody reported any negative side effects to you? I had one patient that was on opiates, not abusing for chronic pain, and really experienced an upshoot in her pain. And we titrate up. We don't start at 4.5 or anything. We start at 1.5. And she tried that, and I said, well, split your tablet in half and try a lower dose. And she tried that, and it just flat out didn't work for her. She just could not tolerate taking it. Other than her, I haven't had anybody
have an adverse side effect at all, like not even nausea. It's just one of those great things where, try it. If it works, then you're going to feel better. If it doesn't work, you're not going to feel anything. And what a great thing and to have
Yes.
for people.
And everybody always asks, and it's like, how long is a piece of string? How long would you say it takes your patients to notice that LDN is doing something for them?
You try to under-promise so you over-deliver. So it takes about a month to 6 weeks to get them on the 4.5, if that's their dose. Sometimes people do stop at 3, but it's kind of hard to know that 4.5 is too high until you try it.
Yes.
But somewhere in that space, and then adding about 4 weeks. So I say 2 to 3 months before we can decide if this is going to work or not.
Yes. I mean, there are most doctors, if you take an average, they usually think by 4 months that their patient, has noticed something. Some people seem to be slower to improve than others, should we say. Yeah. So alongside of the LDN, what do you recommend as in diet, nutrition and exercise to your patients?
Oh, yeah. That's a good point. So I'm pretty big on detoxing, and detoxing is not just a supplement you take. It's a lifestyle, and so they have to sweat, they have to breathe heavy, they can't be constipated, they have to drink plenty of fluids, so they're urinating a lot, and they have to support their liver and kidneys. But a lot of people feel like detox is this thing that they do for a week where they drink this solution and everything's going to be better, and avoid certain foods. But really, it's something you have to do every day.
Could you explain that to us? We haven't actually on the show discussed detoxing, so that would be really interesting if you've got time just to tell us about that.
Well, yeah, our environment is just loaded with toxins. It just comes at us from every direction, and there's only so much that we can do to avoid it. Organic and avoid the processed food. So that's, you start with that. You start with avoiding, but you still live on the planet, and you're still going to be exposed no matter what you do. And so you need to support your body. And so my patient that comes in with chronic constipation, well, that's limiting their ability of their body to remove toxins. And so you have to take care of that constipation because they're toxic. And the more of a train wreck a patient is, the more likely they're toxic. And so sometimes you have to be a little more aggressive, and then they can fall into a maintenance pattern. But you have to sweat. I mean, the reason that exercise has so many benefits is not only are you sweating, but you're also breathing heavy. And those are 2 ways to detox. And usually you have better bowel movements when you exercise, and you drink more water when you exercise. And so exercising is huge for people to stay healthy for so many reasons. It's not just looking good in a bathing suit. It's paramount to feeling better. And you don't have to be crazy Olympic runner, but you do need to get out and sweat every day and breathe heavy.
And I know
that's part of my prescription. You have to get out there and take care of your body.
And I know you said there are things that you can drink to detox every so often, and you're saying it's an everyday thing. Are there any special potions, solutions, liquids
Oh my
you
gosh,
would recommend?
I hear so many out there. There's a lot out there. But anything with the liver support is good. I happen to use, am I allowed to say a brand? Or
yes, go on.
I happen to use the Thorne Medicare program, but there's other ones that are great and fine and healthy, and a 10-day kind of detox program is a good idea, but that doesn't mean that you don't detox the rest of the time, that you don't continue that stuff, but you just don't need to drink this solution and be all crazy. But spending some time to do kind of a heightened detox is a good idea, especially if you're walking to my clinic and telling me you feel terrible and things aren't going well. And so that's when we have to be more aggressive.
I mean, people are lazy and they would rather
Yes.
have the magic pill or the magic solution and not have to work at
Absolutely.
it. Yes. Yeah.
The dichotomous thinkers, the black whites, the yes nos, the good bads. Those are the people. They do wonderful on those 10-day detox programs. They're focused and they're doing it perfectly. But man, when it ends, they're done. They go back to what they were doing, and it's what you try to stay away from. Not everything's good. Well, some things are all bad, but for the most part, you can do things in moderation as long as you're supporting yourself.
I mean, I'm thinking the patients that have fibromyalgia, rheumatoid arthritis, MS, chronic fatigue syndrome, they might find it difficult to exercise, to sweat and breathe heavy.
Yes.
Do you think?
Yeah, and so those people are extra challenging, for sure, but I encourage them to get out for a brisk walk, even if it's only 5 minutes to start with. Mm-hmm. Just start moving. And then as far as the sweating goes, the sauna, that doesn't take any effort. Just sit in a sauna and sweat.
If you're able to do that. I've got MS and that would kill me. I would just...
Okay, yeah. So you do have to make modifications. I mean, even people with adrenal fatigue, they can't exercise much because it makes them feel worse. And so until we can get their adrenal glands responding, exercise is very challenging. Mm-hmm. But they just as much as you can, and you're going to have to base it off what you can tolerate.
I think the thing is with exercise is to start gradual, isn't it? And
yes,
not be disappointed where your baseline is. Treat it that this is the baseline, this is how I am now, and I will try and do a little bit more every week. And then after 6 weeks, you can see how far you've come, rather than try to climb mountains on the first day and wiping yourself out. I'm speaking from experience.
And then not being able to get back into it. Yeah.
Yes. Slowly.
And then the other thing with that, too, is to forgive yourself if you've had a bad week. And I say, just get back on the wagon and do it again. I'm pretty fit. I exercise pretty regularly, but I definitely have weeks where that doesn't go so well. And I don't beat myself up. I just get back to it when I can. Mm-hmm.
That is such sensible advice. So whereabouts is your practice that you work from? Would you like to tell people how to find you?
Oh, sure. Yeah, it's so Albuquerque is kind of divided into 4 quadrants, and we have a river, so anything east of the river is considered east. And so I'm in the northeast Heights, and I'm on the corner of Osuna and Wyoming, and in a kind of office building complex that has been around for a while, and it's kind of quiet and calm here. It's very nice.
And is there a website address?
Yes, www, and then it's Well Life ABQ. ABQ is the short version for Albuquerque, .com. So www.welllifeabq.com.
Mm-hmm. And I should think you've got phone numbers or contact forms or something there on the website.
Yes, absolutely.
And do you have a Facebook page?
I do. It's at Well Life ABQ. We'll find it as well.
Excellent. So the patients that you see, are they all face-to-face consultations, or do you do any telephone consultations or Skype or remote consultations?
From time to time, I'll do a remote. I have a couple of patients that are not in Albuquerque, and those need to be video calls because you do need to lay your eyes on somebody. Mm-hmm. But for the conditions that LDN covers, I can live without the physical exam necessarily. So I'm not opposed to doing that, and I have people that do see me virtually. So
that's good.
That's not been a problem.
Yes. So regardless where you live or what age you are, if they're interested to get in touch with you.
Absolutely. And if I do kind of quiz people before we get started, and I just make sure I'm a good fit for their expectations. Mm-hmm. Start with that, and then if it sounds like it's something we can work with, then we get started and go from there.
If you
in fact, the pharmacy I use to compound LDN it's in Colorado. I don't even use a local one. With cost and quality.
So if some of the patients that you are treating remotely need blood tests, or as you say, draw blood over there, do you work with their general practitioner or their primary care practitioner?
It depends on how the patient wants to approach it. I can certainly send them a list of what they want to order, or I work with Quest and LabCorp, and they're all over the country, and I just enter the orders, and they, a lot of times, depending kind of on the region that they're in, those electronic orders can be pulled up anywhere. And the patient doesn't even need to bring in a piece of paper. But if that's not going to work, then writing an order, and then I post it into their patient portal, they're able to print off the lab requisition and take it to a lab.
Oh, okay. And over here, you see, we have to actually go to our doctor's surgery and have the nurse there do it. There aren't places that you can just go and have your blood taken. These big lab companies, they have a draw center. I mean, I would venture to say in every single decent-sized city in the country. I could be wrong, but most likely so. Oh, that's very, very interesting. Well, that's our time up. So it's been fantastic talking to you, KC. We've learned a lot, and especially about detoxing, which I'm sure people will find very interesting. But I'd have just one quick question. Have you noticed any of your patients going from a high number of other medications down to LDN plus just one or two? I was thinking like some of the fibromyalgia patients that I know that were taking like 14 medications and then have got down to like 2 or 3. Has that been your experience?
I have not been at it long enough to experience it to that degree. I've gotten lower doses. I've definitely got people off the DMARDs for rheumatoid arthritis, and so that's been exciting. So maybe I've been able to decrease someone off, 1 to 2 medications and a lower dose of another. But the multiple medication, very exciting off all this stuff. I haven't gotten that far yet.
Okay. Well, thank you very much once again. This show is sponsored by Mark Drugs, who specialise in the custom compounding of medications, assuring that the client gets the proper prescriptions for their unique needs and conditions. They work with practitioners, integrating knowledge and treatment of experts to create comprehensive health plans. Visit markdrugs.com or call Roselle 630-529-3400 or Deerfield 847-419-9898. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.